And in your current role, you're a strategist for the Women's Health Initiatives at the Missouri Foundation for Health. So, what do you do?
Yes, I am a grant maker. So I support grant making efforts to advance health equity across Missouri, with a focus on Black maternal health and community centered approaches. One thing we look for as funders, grant makers, is systems change, people who are doing the work within the community and changing the systems. So I shouted out Jamal Birth Village earlier. I'm going to shout out Generate Health, one of our grantees. I'm going to shout out Uzazi Village, who's doing this great maternal health work in Kansas City, Missouri. So yeah, I do a lot of project management, ensuring resources are distributed effectively and equitably. I collaborate with my other strategists because the women's health initiatives are just one of the many initiatives we have at the foundation. So right now we're focusing on how can we all work together more effectively. So we have initiatives like food justice. Food justice and maternal health are very similar, especially when it comes to breastfeeding. I facilitate learning and improvement in healthcare needs by convening health professionals and community members. I build relationships with grassroots orgs, which is probably the main part of my job. Building relationships and maintaining authenticity and trust when you're within community is really important with working in this role, especially when you're a funder. A lot of people look at you as like money bags. You're going to give us money, but you need to build the relationship first before you can just give out money. You need to be able to trust each other. So that's something that is really important to me.
Absolutely, and as someone who also works in a funder role in my 9 to 5 role, I definitely appreciate a lot of that. And I think like even the conversation around how you are like actively listening and creating a space like earlier in your journey, actively listening, creating a space for people to share and be honest, I think is a big part of the role, especially when you're trying to work with grassroots organizations that are people that are on the ground, and building those relationships and trusting relationships is so important. How did you get interested in this role, and then how did you market yourself to get this role?
Yes. So when I was at UMSL, one of my grants that I worked on was actually granted to me by my current job. So when I knew I wanted to step out of this role and get back into maternal health, I basically stopped my job link website, and um, I found this role just randomly, and I was like, oh my goodness, this sounds like perfect for me. I already got into maternal health. I know the landscape. I know the folks. So why can I not just be a funder and fund people I know who need the money and who are doing the work? So the way I walked in and marketed myself was as a doula. I walked in as a doula first and as a community member first. Um, and I feel like that's what's made me very valuable at the foundation, because I have personal connections to this work, and I'm in this work all the time, even outside of the 9 to 5. That made them think like, oh, Kira can open up us to a whole nother subset of a community that we have not really been able to tap into. So I really appreciate being a doula. I get all the doula questions, and people are constantly, asking me about doula stuff, and um, it's just really exciting being a doula and a community member and a funder.
I appreciate you sharing that. What do you enjoy most about your role, and what's most difficult?
What I enjoy most is interacting with community and going to community events and learning about what people are doing and what organizations are doing. Um, with the limited amount of funds that they have, um, which is like truly amazing to me. And I was like, I know as a doula, like I use a lot of my own money for my business, but like you're like running the whole business on this budget. Like, whoa. So it just really amazes me the ingenuity that my community has and how passionate they are. I really love that. The challenge is I can't give money to everybody. I would love to fund everybody. I would love to just throw money out. But that's just not how the government works. That's not how things work. So sometimes people go without, and I would just love to say, like any other funders out there, if you're interested in funding maternal health, do it, please. Honestly, if you're interested in funding anything, and if you can, do it. There's a lot of cool people doing cool work that need the money, and money makes the world go round. So please fund them. Please, 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 please.
Yeah, it truly is amazing when you do look at many of these grassroots organizations and you like look at their budgets and then look at the impact that they're able to have in community, and you're like, wow, they are doing amazing work. If they just had just this little bit more money, the amount of impacts that they would be able to have
Yes,
could just be like I don't want to say impactful, but impactful in so many ways. So
yes,
definitely appreciate that. And one last question on this: what are the things that you all look for in grantee partners? What are the things that are important to you all as you all are having like conversations and thinking about funding priorities?
yes. Well, systems change is definitely something that we look for. Uh, and a lot of people are like, what is systems change? And it's like anything that you are doing to disrupt the system. So the example I love to give is like, there's no water, but you are creating a water filtration system in your backyard and you give out water to your community. That's a system change. You're disrupting it. You're making something out of nothing. And we look for like fun and innovative ideas, things that people aren't doing, but you're doing it. You might be the only person that is doing it in your area. Um, we really look towards rural communities. They are people that don't have a lot of resources a lot of the times. Um, so, what are you guys doing down there to help you figure out whatever needs that your community needs? The other thing we look for, um, it's just someone within community. We want someone with lived experience. We want the like Juma Okushonla from Juma. She is a midwife and a doula. Someone who taught me how to be a doula. Um, she went to Ghana and learned indigenous birthing practices. And like that's a person that I just look up to and would love funding because she's within community and she has been a teen mom. She's had kids. She's birthed babies. She's been to Ghana. She's seen the babies. She does everything. Um, so we just look for those champions, those community champions. So you might be that person. I don't know. You have to look us up, and put in an application.
Absolutely. Well, I appreciate you sharing that.